Hi everyone, welcome back. So today I am going to be starting to do some posts on specific muscle groups, and talk about the most common type of injuries that occur in those areas that I see in practice. How to recognize them, what causes them, how you can prevent them, and how you can treat them when injuries actually happen. So the first one that I'm going to do today is talking about the IT band. So for anyone who, is getting maybe knee problems, if you're a runner or a cyclist, you're going to be particularly prone, to this issue. Sort of if you find if you go into the gym every day and you are maybe having problems perhaps with your squat technique, then potentially, the information that I give in this post could be really beneficial, to you. So, first off, I'm just going to explain briefly what the IT band is, because there are a lot of you out there who actually aren't really very familiar, with this part of the anatomy. Okay, so the IT band or iliotibial band is a thick band of connective tissue, which you can see surrounded in blue here. And it forms from the gluteal muscles at the hip and stretches all the way along the outer thigh here, down to the top of the tibia, which is that shin bone in the lower leg. And so through its, connection at the pelvis, it helps to abduct the hip, so to lift the leg away from the body out to the side. And it also, from this attachment here, helps to stabilize the whole knee joint in both flexion and extension. Okay, so the IT band passes smoothly across the end of the thigh, which is underneath this quadriceps muscles up here. And it crosses the knee. You can see the kneecap here when it extends. And so the reason it is able to cross the knee joint smoothly is because of the bursa at the knee, which are fluid-filled sacs that just cushion the joint. But basically when we have some kind of injury or repetitive use, the area will become inflamed. Sometimes these bursa will, also become inflamed, and this just causes friction and consequently pain around this outer knee, because where these, sacs of fluid that cushion the joint become inflamed, the IT band will actually rub on those bursae and just irritate, that outer knee area. So basically, any overuse of the knee joint, repetitive movements, will then increase the risk of something called IT band syndrome, which is probably the most common cause of outer knee pain, certainly in runners and cyclists. The pain often hits just above the knee joint when the heel strikes the ground. So if this is ignored, obviously it's going to get worse. More irritation around that knee joint for the reasons that we've just talked about. And this can cause scarring of the knee joint, which obviously then, contributes to tightening of the muscle tissue, etc. And hence then movement in that joint will be reduced and pain obviously will increase. So what are the main causes of IT band syndrome? Some people just have an anatomical predisposition to it. So for example, if you are someone who has maybe a leg length discrepancy, if you have some sort of abnormal pelvic tilt, which I will also be doing some posts about, or bowed legs, something called knee varus, which I will also be doing a post about. These things will cause the IT bands to become tight, and therefore, you know, they cause friction and irritate around those bursae, you know, when that IT band crosses that end of the femur. Overuse, which we've sort of mentioned briefly, particularly this is in long distance runners and also cyclists, and also other athletes who repeatedly squat. So if you're a gym goer and you're doing your squats every day, you know, again, this is something that you need to be aware of and really ensure that you're using good squatting technique so that you're not putting, you know, extra pressure on that knee joint. So obviously, yeah, including poor training habits, that's another cause. For runners, I'm going to talk about runners a lot because, you know, they are probably one of the groups of people that this affects the most. So you're talking about things like always running on the same side of the road, for example. This can actually create the effect of having a leg length discrepancy. And this is because one leg will always be just slightly downhill compared to the other, causing a pelvic tilt, which obviously can then pull on the IT band. And a lot of people don't even realise that, you know, because it's such a slight angle, people often don't realise that this, you know, this is the case. But it's because, you know, to accommodate for obviously drainage of water during, you know, wet weather on roads, obviously the pavement's always at a slight angle. But also if you do a lot of downhill running, you know, running downhill is certainly more stressful, you know, to the knee joint and the surrounding muscles, but also to the IT band. And this is because when you're running downhill, you need a lot more knee stabilization. So the IT band is kind of, you know, having to work harder. And obviously if you're doing this a lot, you know, could increase irritation. For cyclists, you know, it mainly comes down to poor posture on the bike, and ensuring that, for example, toe clips, you know, are aligned properly. You know, your feet should be facing directly forward. If the alignment of the toe clips, you know, is incorrect, this may actually force the feet to internally rotate, which basically then causes the effect of bowed legs. And what this then does, it increases that angle at which the IT band crosses the knee joint, and therefore increases, you know, the risk of inflammation. Flat feet have also been linked with IT band syndrome, and this is really because of the increased pronation of the foot, which causes internal rotation of the leg and also tension, therefore, on the outer thigh. Okay, so if we look at this diagram here, we can see, so when someone has flat feet, obviously the arch is flattened, and this causes overpronation. So you can see the foot, that ankle is sort of slightly, turning in, instead of in a normal, where someone's got a normal arch and we can see the ankle just kind of straight up. And this increased pronation in this area will then cause certainly the lower leg, but also the whole leg as a whole, to internally rotate. It's turning inwards, which causes the knee to have almost like a knock-kneed or valgus effect, which again I'll be posting about. And through this internal rotation, what happens is the IT band along the outer thigh here and where it crosses the knee kind of gets pulled across the knee. So the IT band is then tightened, and then where it's tight along this outer knee, it's going to cause irritation. So other causes could be things like poor flexibility of muscle tissue. So we're talking about things like, we'd be looking here at the calf muscles, which obviously can, if they're tight, they can pull on the knee joint. And also, potentially sort of any maybe weakness around the quad area, but certainly calves are the big ones to look out for. And in terms of squatting technique, tight calves, you often see when you ask someone to do a squat, because you find that their knees will then kind of buckle inwards. Also other mechanical imbalances, so we're looking in areas like the lower back, the pelvis, hips and knees. And as we've said, the IT band, attaches, at the pelvis. So obviously, any pelvic tilt, is going to influence what happens with the IT band. If you've got, for example, a lateral pelvic tilt where you've got hip hike on, say, your left side, then you can expect that the IT band on your left side potentially will be pulled up, by that pelvic tilt. And then finally, activities, things like rowing or weightlifting. Obviously we mentioned running and cycling, but yeah, as we've said, any activity or gym exercises where there is excessive knee flexion or squatting, again, is going to put increased pressure on that IT band. So yeah, it's just really important to ensure that you're using correct technique when you're doing these exercises. Okay, so we're going to look at symptoms now of IT band syndrome. We've talked about pain and inflammation, and inflammation of the IT band, which you can see this white band coming down here. Can certainly, as we've said, cause outer knee pain, and also possibly pain in the hip as well. So you can see here we've got the gluteal muscles and the TFL, with the top of the IT band inserting around the pelvis on that outer hip, and it comes all the way down the outer thigh. You've got the vastus lateralis either side here, which is one of the quad muscles, coming down to the knee, and attaching on the top of that tibia or shin bone. So, yeah, basically a tight IT band can cause knee pain on that outer edge of the knee. And this, as we've said, is due to inflammation, where that band crosses the end of the thigh bone, and pain really usually starts as a sort of a pricking sensation, but it can develop into more of a stabbing pain. As we've said, the pain really sort of tends to hit when the heel strikes the ground. So definitely one for you runners to be aware of. And the pain may actually radiate up, the outer thigh, as we've said, as far as the hip. Now, other symptoms is that there may be a sort of a snapping sound at the knee, and also some swelling, either sort of laterally on the outside of the knee, or actually even just below the knee. So that's also something just to watch out for. In terms of treatment, quite a few things that you can do. As you're going to become very familiar with on these posts, standard sports therapy treatment, RICE. So you rest, stop doing the activity that's causing the problem for a little while at least. Ice to bring down any inflammation. Compression. You may want to wear some kind of sort of support, although probably, in terms of IT band syndrome, that's not really so much something that I would be recommending. Obviously if it was sort of an actual joint, then that would be more likely. But an elevation, just resting, ice, and keep the leg up to just in that inflammatory stage to try and reduce the inflammation, which will then help with reducing the pain. Obviously you can take anti-inflammatories, things like ibuprofen, but do be careful if you have gastric problems or if you're asthmatic, because ibuprofen is probably not the best one for you, but you can ask your local pharmacist. Stretching, obviously, I've done some posts about stretching. Obviously that will just help maintain the flexibility of not only the sort of surrounding muscles, but obviously it will just help to keep that connective tissue. Not that you can really stretch connective tissue that much because it is very sort of thick and fibrous, but it will just help keep everything as flexible as possible, and ensure good range of movement. Certainly massage, it's probably one of the areas where people will come into me for a sports massage, and it's sort of one of those areas where people aren't necessarily aware of the IT band, and I would say more often than not, it's there's a fair bit of tightness there, and people will suddenly sort of say, what is that? That really hurts. And yeah, it's the IT band, but certainly going for a sports massage, having some myofascial release just to work on that connective tissue will really help ease off sort of the pain and just ease the tightness a little bit. You can also obviously seek physiotherapy, certainly if you're someone who has something like flat feet, maybe seeking some kind of orthotic treatment. So whether that be like wearing arch supports in your shoes, or perhaps if you are sort of someone who kind of maybe does tend to run downhill, or your running route kind of does involve some hard surfaces, might be an idea just to get some sort of shock absorbing insoles as well in your shoes, just to take that impact off that knee joint, which again will just help to reduce the sort of risk of irritation on that outer knee. Steroid injections are always an option, but they are temporary. It's not a long-term solution. In very rare cases would you see any kind of, surgical intervention. So yeah, it's really about maintenance and prevention, which I am going to talk about now. So there are certainly things that you can do to either prevent problems with your IT band in the first place, or to prevent a reoccurrence of an injury, once you've had one. So again, maintaining flexibility and strength of the lower back, the hips, the knees, and the leg muscles by good old stretching. And depending on what type of exercise you do, will certainly affect what type of stretching you do. So do take a look at my previous video on stretching, so that you can kind of weigh up the pros and cons, and get what's right for you and your workout plan. Don't overdo training. Whenever anyone sort of, maybe as you're starting out on a exercise plan, or maybe you're, I don't know, looking at doing a competition, it's very easy for people to get kind of very much in the moment and get really excited and really, go for it, and probably push themselves too hard. And this is where injuries happen. This is where you kind of go in too fast when maybe your muscles aren't quite ready, and you're going to kind of irritate something, or end up with strains and things. So if you're a runner, don't run on hard surfaces if you can help it, because obviously you're going to have a much bigger impact through that knee, and try to kind of vary your route. Don't always run on the same side of the road. Try to sort of, if you want to do some downhill running, just try to maybe keep the downhill to a minimum, and try to run on more even surfaces if possible. Don't run in old worn out shoes. It's another thing I'm going to talk about a lot in my posts, is make sure that you've got supportive shoes with arch supports if you've got flat feet, and also regularly replace your shoes, because once they're becoming loose around the ankle, they're not supporting your foot in the way that they should be, and that can have a knock-on effect on your leg muscles and that knee joint. Likewise, if you're a cyclist, make sure that your toe clips are aligned properly, and that your feet are pointing, toes should be pointing forward when you're pedaling, not rotating inwards, because as we've said, that increases that angle that the IT band crosses the knee and makes you more prone to irritation and inflammation. And yeah, as we've said, just if you are flat-footed, arch supports, or maybe if you're doing something like a marathon running, it's an idea just to get those sort of shock absorbing insoles as well, again just to reduce that impact through the knee. So I'm now just going to take you through a couple of basic simple stretches that you can use to try to relax the IT band. Certainly if you come for a sports massage treatment and there's a real issue with the IT bands, there are stretches, passive stretches that the therapist would do. But these are just a couple that you can do yourself at home, if you feel that it may be a little bit of an issue. Okay, so the first one is a side lying IT band stretch. So you're going to be like laying on your side, support yourself, with your hand at the head, and then you're just gonna, so basically whichever side is tight, it may be that you have both sides tight. If it's only one side, then you want the tight sides to be on the top leg. And we're going to just bend that lower leg forwards. We're going to take the top foot behind and just grab that with the top hand. And then we're going to place that bottom foot across just above the knee, so where the IT band is coming down, and we're just going to pull that foot on that knee, pull it down towards the floor so that you're going to get a stretch along this IT band here. So the knee is going to be getting pulled down, and that will just stretch all along that outer thigh. And obviously, if you're tight on both sides, which is most likely, then you just repeat on the other side. But you want to probably hold this stretch for about, let's say, sort of 10-20 seconds. So the next one is a seated hip and IT band stretch. So just sitting on the floor with legs straight out in front, and you're going to support yourself with one hand behind you, and then we're going to just take one leg, place the knee, bend the knee, and then place the foot across the other leg at the knee, and then we're going to just grasp around the top of that knee with the other arm, and then we're just going to turn away, facing in the opposite direction of where that leg is pointed, and you're going to pull across sort of the opposite way with that arm so that you get a good stretch down the outer thigh right into the hip. So basically your head is turned one way and this arm will be pulling the leg towards that foot. And then the last one is basically taking the knee to the opposite shoulder. So you're going to lie on your back and you're going to bend one leg up, and you're just going to grasp with the opposite hand just on that outer edge of the lower thigh, and you're going to pull that thigh down towards the body, which again will just produce a good stretch along the outer thigh. And you want to sort of be aiming, while pulling down, you want to be aiming the knee across, to the opposite shoulder. Okay, so that is really sort of all the basic information on the IT band and how you can prevent the onset of IT band syndrome, or even prevent just general tightness in this area. and I will be doing sort of more posts on the surrounding muscles and common injuries there as well, which will tie in with with this issue. But certainly, if you do have an IT band issue, it's worth taking a look at the post that I'm going to be doing on pelvic tilt, calf injuries, and also sort of around the glutes and the hip muscles. So yeah, feel free, you can subscribe and then you'll be notified when they come out, or you can leave a comment or message me through my Facebook or Instagram pages and I will always reply. But for now, that is really it from me. So I'll see you next time.